Is Dr. Lawrence Freeman still here?
Yes, I
There he
am.
is. Hey, how you doing this morning? Thank you very much for being here. I have you down from 9:40 to 10 o'clock, and we'll finish with Q&A for about 5 minutes. And I will be timing, but thank you for being here and sharing your time and your wisdom from over 30 years on the African continent and with the African continent. Thank you, sir.
Thank you very much, and I appreciate the opportunity to be speaking to you all today and to participate on this webinar. I'm going to speak about the impact of COVID-19 on Africa and the world and on our thinking. What has happened is that the COVID-19 has revealed underlying weaknesses across the entire world, and now they're all there for us to see. The globalization was not a success. Gyrations on the stock markets do not indicate or represent real value for economic wealth. I've known this for a long time, and now I think other people are going to see this as well. The so-called advanced sector nations have actually, from the standpoint of physical economy, have been contracting for decades. It should be obvious to us here in the West that the cutbacks in healthcare infrastructure over the last 40 years have now shown themselves to produce a catastrophe as far as the United States and other advanced sector countries dealing with this crisis. In the developing sector, and in particular in Africa, we're looking at potential mass death potential with the COVID-19 intersecting the food crisis and other economic shortcomings. The failure for Africa to industrialize, as our other speaker mentioned, the fragile health infrastructure, massive poverty, the dependence on 1,000-mile-long food chains and supply chains, and food insecurity across the continent have made the Africans a potential hotspot beyond all others at this point. The conditions in Africa cry out for transformative change. Not a bit of tinkering here and there, but what is urgently needed is a new paradigm for development, and which I will refer to as the new Bretton Woods system. The United Nations Economic Commission on Africa, UNCA, said that the deaths on the continent from COVID-19 could be from 300,000 to 3 million. David Beasley, the director of the World Food Program, has said that 825 million people in the world are food insecure, with a large portion on the African continent. He reports that 135 million people actually are starving. Food insecure means they miss a meal a day, but 135 are starving, and that could increase to 265 million as a result of the COVID-19 crisis, because the impact of COVID-19 on shutting down borders, shutting down transportation, keeping people locked up in an economy that's fragile and weak, the results could be far worse in food starvation and death than they could be in COVID-19 itself, even though the COVID-19 is what's exacerbating the crisis. Beasley says that we could be seeing mass famine of 150,000 to 300,000 per day, with countries in Africa potentially could be the hotspots for this famine, including Nigeria, the Democratic Republic of the Congo, Sudan, South Sudan, and Ethiopia. This is a very dangerous situation, and this intersection of the COVID-19 on the economies of the African continent are what is causing concerns and fears of experts throughout the world. And of course, this is what we have to correct, and actually should have never been the case. The World Bank forecast that economic growth for African countries for 2020 will decline from negative 2.1% to as high as negative 5.3%. Why is this the case? We have to look at the conditions in Africa. 60% of the world extreme poor, that is approximately $1.90 a day or less, 60% of the world extreme poor live on the African continent. 70% of the world population that lack electricity live on the African continent. approximately 600 million people do not have access to electricity. 336 million people live in slums, which is over half the number of people who live in urban centers on Africa. 61% of the world's workforce, according to the International Labor Organization, are in the informal economy. In Africa, you have 86%. Now let's talk about the informal economy, because this is the problem. This is the problem of poverty, which is a propitious host to the disease. I mean, the informal economy, as we all know, is living hand to mouth, surviving, finding a way to survive that day or the next day, to make a little bit of money to bring home to your family to keep them alive. It is not a productive job. It is not a high-paying job. It is not a job with wages, security, health insurance, unemployment insurance. This is one of the great weaknesses of the failure to industrialize Africa, to have a robust manufacturing and agricultural sector, is absorbed in the informal economy, which is bad. It's a cancer, really, because it drags down the productive capabilities of its workforce, and it decreases the profit of the physical economy itself. These conditions, lack of electricity, lack of clean water, lack of sanitation, lack of productive jobs, lack of food, and massive poverty, are the conditions of which COVID-19 now enters into Africa. And that is why so many of us and so many experts are very concerned about the potential death rate, even though it has not reached that level at this point. Nevertheless, the potential is there unless corrective measures are taken. And this is what we must be working on. Now, if you look at the question of the COVID-19 itself, I looked at the figures. Beginning in March 30th, 2020, there were 4,760 cases of COVID-19 on the continent and 146 deaths. Now, this may be underreporting throughout because Africa may not have the ability to have proper reporting of statistics. But let's work with these statistics. 4,760 cases, 146 deaths. As of June 15th, yesterday, there were 244,000 cases of COVID-19 and 6,546 deaths. Now, this is a very small percentage of the global number of people who have COVID-19 cases of 8 million approximately. But nevertheless, the growth is substantial, from 4,700 to 244,000, from 146 deaths to 6,500 deaths. Let's look at the two largest countries on the continent, sub-Saharan I'm talking about. On March 30th, South Africa had 1,280 cases and 1 death. Nigeria had 111 cases and 1 death. 10 weeks later, June 15th, South Africa has over 70,000 cases from 1,200, and Nigeria from 111 has 16,085. South Africa went from 1 death to 1,480 in 10 weeks, and Nigeria went from 1 death to 420 in 10 weeks. These are a rapid rise. It's still a small percentage of the 8 million cases worldwide and the 437,000 deaths. But nevertheless, the potential for a steep takeoff is there under these conditions. And that's what we have to look at. Now, what are the conditions? Some of you may be old enough to remember that in 1946, or read about, there was the Hill-Burton Act passed in 1946, a year after the death of President Franklin Roosevelt. And the Hill-Burton Act stipulated that there should be 4.5 hospital beds per 1,000 people. Now think about that, 4.5 beds per 1,000 people. In this current COVID-19 crisis, the United States was a hotspot, and we had 2.9 beds. So we were significantly below what was suggested in 1946. We actually have reduced the number of beds in hospitals in the United States significantly. Italy, another hotspot, has 3.9 beds per 1,000 people. Wuhan, China, had 4.3 beds per 1,000 people, plus they built 10,000 beds overnight practically. Now let's look at sub-Saharan Africa. 25 nations out of 47 in sub-Saharan Africa have less than one bed per 1,000 people. One bed per 1,000 people. We would need approximately 300 to 500,000 beds, approximately 1 to 2,000 new hospitals with ICU units, ventilators, PPP, etc., to handle the potential crisis, just to meet the Hill-Burton standard of many, many years ago. What else do we have to look at in a health crisis? Physicians. The United States has 2.3 physicians per 1,000 people. And look how many people have passed away in my country. Italy had 4.2 physicians per 1,000 people. And we saw the death rate there. Sub-Saharan Africa averages 0.21 physicians per 1,000 people. Less than essentially 1/5 of a doctor per 1,000 people. And you have in 20 of the sub-Saharan African nations, it is 0.08, less than 1/10 of a doctor per 1,000 people. This cannot be continued. 47 sub-Saharan African nations have a total of 170 medical schools. That's why that's a major problem in graduating and training doctors. 20 of those nations have one medical school, and 6 of those nations have no medical schools. That's got to change. We need medical schools, we need virology centers, we need advanced scientific and technological training centers in all areas of science and including in healthcare. If you think about electricity, just to provide electricity for all these hospitals and beds that have to be built, you're talking about 50,000 megawatts. Sub-Saharan Africa has between 100 and 135,000 megawatts currently. So you have to increase it almost 50% just for your hospitals, not even discussing what the population needs. You cannot fight a disease without electricity. What about clean water? You can't fight any disease without clean water. The Africans really have the water and the facilities to wash their hands several times a day. One report is that only 16% of African households have indoor water access that they can go to. These are very serious. You talk about underlying conditions for the COVID-19 for individuals. These are the most serious underlying conditions for Africa, along with disease itself. The number of people with AIDS, malaria, tuberculosis are all underlying conditions. This is why we have to change the situation. This crisis has now brought to our attention the weakness that has existed for, let's say, since the liberation movements of the 60s. We've now had 60 years where we have not corrected what was done by slavery, colonialism, and neo-colonialism. Now is the time that that correction has to be made. Prime Minister Abiy called for canceling debt for the debt service for the next 2 years. He's correct. This has been echoed by other African leaders. Debt is not as important as human life. But we have to go much further than this proposal of canceling debt. We need a new conception of economics. We are not animals. We are not governed by pleasure and pain. We are not governed by the invisible hand. We are human beings, and we are sacred because we have the power. We've been endowed with unique power of creative reason. Creativity is what makes each human being in Africa and everywhere in the world invaluable.
Dr. Freeman, 5 more minutes.
And this is the universal principle that must guide our policies. Franklin Roosevelt, when he initiated the Bretton Woods in 1944, set up the bank, the International Bank for Reconstruction and Development. He intended that bank to remove the freedom of the desire of want, to remove from the world freedom from want by developing the world. This was his intention. The Tennessee Valley Authority was the great infrastructure program he intended to export to the world. He had great visions for Africa, including greening the Sahara Desert. This vision died in 1945, April 12th, and a little man, Harry Truman, took over and allied with Winston Churchill to give us the Cold War and maintain colonialism. Now is the time for us to have a new Bretton Woods, to bring a new commitment to science and culture, to develop new ideas and industrialize Africa. My wish for the African youth, I don't think there's too many African youth. I'm not worried about overpopulation. All these young people have creative minds, and their creative minds and souls have to take up the mission to finally industrialize Africa, to bring it up to the level that it should have been over at least a half century ago. To the mission for young people in Africa is to engage in new scientific and technological discoveries that will bring an end to hunger and poverty. And so this COVID-19, even though it's an ugly, deadly crisis, becomes the opportunity for us and friends of Africa and Africans themselves and Africa youth to finally do for the continent what should have been done many decades ago. Thank you.
We applaud you, Dr. Freeman. Thank you for those wise words, and also the dire challenge that you've given to each and every one here, and of course, all governments across the globe, not just in the African continent or within the Northern Hemisphere, but around the world. Let me start off with a question as we're waiting for others to provide their question. You're talking about this as an opportunity to move forward, Dr. Freeman. What do you see that would be, say, the top 3 priorities you're looking at for the continent among all 54 countries? And thank you.
Thank you very much for the question, sir. What is primary, absolutely primary, is infrastructure. There are many silly people who think that Africa can somehow skip over infrastructure. It cannot. We need over 1,000 gigawatts of power for Africa to catch up to the rest of the world. We need east, west, north, south, high-speed railroads. So we have to have infrastructure. We have to have a manufacturing sector, so we don't have to buy products from the rest of the world. It's a matter of national security that you can produce your own necessary products for life. We have to advance the agricultural industry and make it into an agricultural processing industry, so that, again, we're not buying food either from across the continent by thousands of miles or across the world. These are essential components of a productive economy for African nations to provide for their people. Food is a national security question. If you have a hungry population, you have instability and insecurity, as we see most especially in Northeast Nigeria in the Lake Chad Basin, where that area of the world is suffering from the shrinking of a lake, which we could reverse through policies that I and others have advanced and transform that area. That can be water projects, energy projects, rail projects can be initiated across the continent.